a pushy broad from the Bronx, New York. Follow her voice, a stray dog is nice. She's a pushy broad from the Bronx, oh yeah. Don't be surprised if you wanna listen twice. Make decisions, find the right choice. Know yourself better, find your own voice. It's okay if you need help today, cause everybody needs a little push. From the pushy broad from the Bronx, New York.
Welcome, Transformation Talk Network listeners. My name is Ellen Stewart, and I am the Pushy Broad from the Bronx. Welcome to my show, Recovery Recharged, where we share advice and assistance from experts in recovery. I am so glad to be here today because I am talking about a topic that every one of you can get behind. I have such an expert with me today because he really makes a difference in the recovery industry. The topic today is men's issues in addiction and recovery. And I've centered around men because there are distinct differences in how men view addiction and recovery from women. Last month, we talked about women's issues, and this month, it's really important that we talk about men's issues. I also want you to know that we are very much aware that this is National Recovery Month, and we want to reach out to everybody out there and tell them that we are the program for help and wellness in recovery. So go to pushybroadfromthebronx.com, make an appointment with me. I will absolutely help you in this recovery month, especially. So, are there sex and gender differences in substance use and rate of recovery? Believe it or not, guys, men are 2.2 times more likely than women to abuse drugs and 1.9 times more likely to develop a new drug dependence. So, how do we look at these issues? How do we treat them? How do we help our loved one? How do we help our husbands, our brothers, our sons? I've brought an expert today that is going to give us some answers. He's been on our show before a couple of years ago, but I wanted to bring him back because he does specialize in this and he's a great resource for us today. I'd like to introduce Paul Lavella Jr., who is the founder and clinician of New Jersey Recovery and Wellness. He's a licensed professional counselor, a clinical alcohol and drug counselor, and he helps people heal from substance use and co-occurring disorders. And he's been doing that for the past 19 years. New Jersey Recovery and Wellness provides community counseling to individuals and families, partners with community organizations to reduce the stigma surrounding behavioral health, and consults with other organizations to improve treatment outcomes. So, Transformation Talk Radio listeners, Recovery Recharged and the Pushy Broad from the Bronx is thrilled to introduce Paul Lavella Jr. Good morning, Paul.
Good morning, Ellen. Thank you so much for having me back.
I am thrilled to have you here today, and we're going to jump right in because there are so many questions that we want answered, okay? Let's talk a little bit about the kind of work that you do, and specifically one big question. Why? I know it's a broad one, but let's narrow it down a little bit. Why do men drink, and do gender issues, being male, play an issue in drinking and recovery?
So I want to thank you for taking time in this episode to really highlight this issue. It's very important to me. It kind of centers around the work that I do personally and generally speaking within the practice, New Jersey Recovery and Wellness. So just a short clip. We are a co-occurring group practice. So individual therapists. Some people work with couples. Some people work with families. But people come to their therapy session and go home. We're community-based. And with some recent stats that we've run from the first part of this year, about 60% of our clients are men. And with the majority of our clinicians holding licenses both in mental health, but also for substance use disorders, we do see a lot of men who are in recovery or are trying to make some of those pivotal changes in life to support recovery. And it's important to make sure that these clinicians are absolutely versed in some of the rather nuanced differences in providing counseling services for men who are trying to make these significant life changes.
Do you find that men seem to start using substances in general earlier than women?
So that's not only something that I've noticed anecdotally within our own practice, but also there's plenty of data that would support that. Generally speaking, men, younger boys, teenagers tend to have more ready access to alcohol and other substances than women do, and it's also not frowned upon in some sense. So we can, I'm sure that we're going to end up going there in conversation about.
Well, let's go there. Let's go there. Hang on a second. Let's go there. It's not frowned upon. You're talking probably specifically about alcohol, because I'm sure the drug connotation is probably frowned upon. So let's explain that a little more, the not frowned upon situation.
Oh, absolutely. But I will challenge and push against the drug part too, because especially now with the dynamic cultural shifts towards marijuana use, right? And so like, okay, I consider alcohol to be a drug, but I know not everybody does, but marijuana kind of goes into that fold. But we do generally see this cultural perception, and there's a whole lot that comes into culture, gender being one of those variables, right? And so we're focusing on that. When taking a look at the social acceptance of alcohol use or other substance use for men versus for women, for boys as opposed to for girls. I know even providing counseling services to the teenagers that we're working with currently, there tends to be more of a social stigma is a little bit too strong of a word, but almost like a connotation, a safety risk for girls that are using substances, whereas for boys, it's almost like an eye roll, a rite of passage. Boys will be boys. It's almost thought of as a given. It's going to happen, right? And so this is what I'm talking about. One layer of accessibility that boys have that girls may not.
Right. I understand. I understand the rite of passage thing. And of course, I see this in my male adolescent clients and their parents, right? I have a discussion with dad whose son is drinking a little bit and maybe experimenting with THC vape pens and all of that stuff. And dad will say, it's no big deal. It's a phase. He's a boy. What do you expect from him? It's going to pass. All of those things, right? That rite of passage. So maybe that's the case, right? So just explain to us the things that we see every single day, the people out there. What makes it more than a rite of passage? What makes this a problem?
Well, that's a very, very loaded question, very important question, Ellen, but a very loaded one. But so to kind of go back to that idea of culture and cultural messaging, I think it's important to start there to kind of give the lens with which to address the much larger question. So as we spoke on a moment ago, there's many different components to culture, right? There's gender, race, religion, socioeconomic status. The list can go on. But for focusing here, we really want to take a look at the cultural messages that we're giving to our young men and that our boys are receiving. And some of the most common ones, there is some shift that's been happening over the course of the past number of decades. But one of the most common ones is big boys don't cry. Right. And so if we're going to look behind the curtain of that message, what's actually being communicated there, it's not masculine, it's not in our maleness to express emotion. So we need to hold things in. Right.
Yes.
So,
and with that, yes. And with that, of course, expectations of strength and being a protector and showing no fear, all of those things are sometimes beginning to change over time. But there is a standard, and there are assigned specific gender roles that we still deal with on a regular basis. And that sometimes is the strong messaging that comes down. And because of that, boys have to hold stuff in, right? They just have to hold all of their emotions in. And sometimes the way to overcome that anxiety and that stress, of course, is to use a mood-altering substance, correct?
That's definitely one of the pathways that people can do that. More specifically boys, but it's not limited to boys. Anyone can self-medicate through those means. It's not just about substance use. People can act out in a variety of different ways, whether that's with alcohol, drugs, gambling. We all have cell phones that we can check out on, so on and so forth. And that's another line of work that our adolescent clinicians have been doing quite a bit of for people that have what they're referring to as like a tech dependence or tech addiction. But then, we also take a look at problematic pornography for our teens. That's been something that's been around for a while. We're seeing it a lot more now with the advent of the accessibility, so on and so forth. But generally speaking, there's lots of ways that our young boys can act out because they're getting these messages. It's not okay to communicate or express emotions. We have to keep things in. And it's not just about keeping things in. We need to exude confidence, strength, control. And so sometimes for some people, that can create almost like an imposter syndrome. So if this is what I'm being taught or groomed into exuding, but I don't feel this way on the inside, am I a fake? Am I not worthy? Taking a look at some of the internal messaging that our boys can be deriving from that. And so there's there's mild damages which can then grow into something bigger. And if we're not cultivating an environment where our boys can sort this stuff out, there's lots of opportunity in the future for them to try to reconcile it in some not so great ways.
And I've also seen evidence of more eating disorders among young adult males more than ever before. Compulsive overeating, eating poorly, and even some anorexic and bulimic young males, which hasn't generally been a male-oriented situation. But I think that you are correct in the fact that self-esteem plays a very big role, and of course, lack of personal self-worth. And boys also do measure themselves against other boys in competition, in sports, in intelligence, in everything, in physicality, which makes it much more difficult for them to be who they are, open in the world, be who they are.
That's right.
Yeah, I really agree with you. So let's talk a little bit about some of the impulsivities and the immaturities. If somebody's a little bit more emotionally dysregulated, where do we go? How young do you see it starting? And what can you advise parents? What are they looking for?
Yeah, so that's again another thoughtful question there. When we're talking about difficulties with regulating emotions or expressing emotions, I know from a therapeutic lens, there's a specific type of therapy that focuses on 4 core components. And so 2 of those components are distress tolerance and emotion regulation. So distress tolerance, when something isn't going my way or I'm in an uncomfortable situation, and then emotional regulation is, I can feel things and it's okay to feel things, but how do I modulate that? So not to the point where I'm exploding and acting out, but also not on the other end of the spectrum where I'm completely restricting, because emotional restriction for anyone isn't healthy. And it tends to be a key component for our young boys, which is why they may be self-medicating on the side. They may be finding things to help them numb out their emotions. So what parents can look for here is emotional reactions to day-to-day events, right? And it doesn't have to be about school, because I'm sure we can get a lot of shut down responses to how was your day at school? Fine.
Give us a couple of specific examples of questioning and emotional responses.
Yeah. So this is like a more local regional news for us here in New Jersey. One state away in Pennsylvania, there was a recent prison member breakout, and someone has been roaming around in like the backwoods of southeastern Pennsylvania. Topically, it's come up in sessions as well as in personal life over the past 2 weeks. And even just like, oh wow, did you hear about this? What do you guys think about, like, even just checking in to cue in for emotional reactions, checking in on emotion words? How does that? I sometimes frown at myself when I hear myself saying, "How does that make you feel?" It's a therapist trope, but really for adolescent development, just in general, we want to hopefully be building on our emotional intelligence, our emotional IQ, and boys tend to be a little bit more stunted there. So just kind of keeping that door open for checking in on responses, reactions. Friendship situations. If there's an argument with friends, if they stop hanging out with their crew for a couple of days, hey, what's going on? Just making sure that door is open can be vitally important for young boys.
Of course, especially not eating at all or eating too much or isolating in their room for a long time or being very preoccupied on video games or being very preoccupied technologically more than usual, having them seem flustered, stammering, all of the indications that something is amiss. You may not be able to put your finger on it, but something is not the norm for your individual child, right? These are things to look for, and the frequency of those events, correct?
Correct. And what you're talking about is extremes in behaviors. And so now the piece, and I thank you for tagging it on there as well, is every child is going to be different. Every child is going to have their own personality disposition. When you're seeing an extreme in behavior that is different for your child, that's going to be a pretty prime indicator that there's an opening here to have a conversation, which they might be closed to, but just making sure that they're aware that the door is open to it.
Correct. All right. And then, of course, we're not only talking about adolescents, we're talking about young adults, and we're talking about males in general, right? So when you are dealing with young adult males that are in the throes of maybe substance misuse and looking to get clean and sober, talk a little bit about the kind of work that you do with them and what you're seeing here in terms of what a young adult male seems to be going through, college age, school problems, those kinds of things.
Mm-hmm. So true to form for some of the concerns that we were talking about before, and knowing in the back of our heads that there's been a lot of front-loaded messaging of it's not okay or not safe to communicate emotion. If I try to talk about it head on, that can very easily be rebuffed. So when working with young men, being able to approach with that knowledge and with that sensitivity, that talking about something directly with some folks, you might be able to get some traction on it. For many more, possibly not. So the idea of being able to have an activity base, something that you're doing with the individual, can help to open up some doors to processing through other things that are going on in their lives. I know sometimes with parents, whether it's teens or young adults, I frequently hear that car rides can be the best places for conversations because we're not looking at each other, we're looking ahead, or perhaps the person that's not driving might be on their device. It's less threatening. And a person may be a little bit more open to just free flowing with what's going on in their head. And then you'll also find that a lot of treatment programs that specialize in treating substance use disorders for specifically young adult men, they engage in a lot of adventure therapies. So adventure therapies is engaging the clients in activities to work through situations that are going to be evoking emotions, where they can then process during or after the activity.
That's very interesting, especially what you said about car rides for that specific reason. I also find that teenagers and young adults in general have a very difficult time looking you straight in the face. And it doesn't necessarily mean that they're lying to you either. People, parents say, look me straight in the face, or else you're lying to me. That one has nothing to do with the other. But the fact that a child can be more comfortable when they're not put in the spotlight, so to speak, is a very good way for them to open up. I know that my college age clients are engaged sometimes in family group activities. So you may not be able to get them one-on-one, but maybe mom, dad, and siblings can go out and play golf together, or you can play, you can go to the batting range together, or, you can engage in some other activity, athletic activity that guys might like or not. Or maybe if a guy isn't athletically inclined, there's a creative activity, there's an arts and crafts situation, or something that they can build or do or engineer that you may do together, even if it's sitting at a table and putting a puzzle together. Some other kind of distraction so that they would open up more and not be so concentrated on sometimes the words coming out of their mouth. Right, Paul?
That's right. The anecdote that was coming up for me is more centered around the difference between being the focus of an interaction versus being a part of an interaction. So when we're doing things together, I'm a part of something, we're communing, I'm part of a community. We're all humans, we're social creatures. Somewhere instinctually in all of us, we're seeking out community. And so that is really connecting with that part of our young men. However, because for strength, for the messaging of not being emotional, being the focus of something. Are people paying attention to me? Is there something wrong? Am I weak? Those more face-to-face, more direct, that can be challenging for some folks. So being able to get outside of that box is super important.
And it's something for parents to realize. And sometimes it's a question for parents. Sometimes it's a question of who can get through the most rapport. The other thing that I have seen happen, and maybe you have seen it too, parents come to me all the time and they say to me, I want to sit down and have a big conversation with my son. I want to know what's going on with him. I want to teach him something. I want him to understand what he should be doing and what he shouldn't be doing. I always advise parents, and tell me if I'm going in the right way, but I always advise parents that there never should be one large conversation, because attention spans are so small. Number one, you can only have them for 5 minutes at a time. And sometimes 2 or 3 words or 2 or 3 sentences are better placed than one large lecture or teaching opportunity. Do you think so, Paul?
Absolutely. You're bringing back memories from my younger years as a clinician cutting teeth, running an adolescent intensive outpatient treatment program. My former supervisor and mentor at the time used to always share the perspective and often call it out during parent groups. Parents, if you're talking for more than 2 minutes, it's a lecture and your kids have tuned out. He would always make it a point of, after the long lecture, to check in with the teen and be like, can you just paraphrase? What did your parents say? 9 out of 10, they wouldn't be able to effectively paraphrase what had gone on. And so it was hopefully a learning opportunity for the parents, that the desire to have the effectiveness of one big, large intervention, it's actually false. The effectiveness isn't translating over to the teen. So that's you brought up some really, really great memories. And I'm thinking of a family that I've recently worked with as well. The young adult male doesn't necessarily have a substance use disorder, however, is acting out within another behavior group, which is causing lots of problems. But same deal, the focus on having a family session and the process that unfolds there. Mom and dad take their turns with talking, and the young man visibly appears disengaged off to the side, literally like turned facing the other direction, not maintaining eye contact. And then when you go to check in, not that
There's nothing there.
Little
Right.
is registering, except
Right.
I did something wrong. I'll do better next time, whatever you guys want. It's like, it's a script. How many times have you said those words? If we want to be effective, it's not one conversation. We want to keep the door open to have ongoing communication.
I understand completely. And I say this to parents, and here's a big thing, parents out there. If you're going to make this a lecture moment or a teaching moment, don't do it. Do not do it. If you think you're going to impart some profound words of wisdom, it's not happening. Okay? Don't do it. Your kids are getting nothing out of it. Just walk by occasionally, tell them you love them, tell them you'll support them. Tell them that they should make healthy choices, little sentences, little proud sentences. I'm proud of you. I love you. You can come to me for anything, little phrases, and walk away. They will hold on to that more than the 15 or 20 minute. We want to have a family session about how you're going to improve the next year of your life, especially since this is the beginning of the term, right? So parents want to sit down and say, let's plan for the term, right, Paul?
Absolutely, and there's also something to consider there when it comes to relational equity. I'm trying to recall exactly where I got this analogy from. However, it was rather poignant. It kind of like hit the nail on the head for me. The idea of if we want to maintain open engagement with anyone in our life, but I've specifically known this to be true for the young men that we work with, you need to really consider the ratio of your critical feedback to your praise, to your solution focus, to your looking and moving forward, right? And so it's like, all right, so you've got two piggy banks, two bank accounts. How often are you depositing into the criticism bank account, and how often are you depositing into the praise bank account?
That's a perfect analogy. I am really thrilled with that. I need you to keep that in mind out there. How often are you depositing into the complimentary bank account? Terrific. When we come back, we're going to talk more about men's issue in recovery with my expert, Paul Lavella Jr. We'll be right back. Welcome back, Transformation Talk Radio listeners. I'm Ellen Stewart. I'm the pushy broad from the Bronx. Welcome to my show, Recovery Recharged, with my expert clinician, Paul Lavella Jr., and we are talking about men's issues in recovery. You can find me at pushybroadfromthebronx.com. Please go there. I will do the first 20-minute session with you for free. I will give you all kinds of help and assistance around recovery. Paul Lavella Jr., please tell us where we can reach you for help and assistance.
Thank you again, Ellen. So, my name is Paul Lavella. Our practice is New Jersey Recovery and Wellness. So, generally speaking, people can access with questions or seek resources just by giving a call, 855-202-7939, or by going to our website at njraw.com. That's NJ like New Jersey and the word raw, RAW, as in recovery and wellness.com, njraw.com.
Thank you so much. All right. So let's get into some more of the heart of it.
Absolutely.
You're an adult male, you're living at home, and you may be drinking too much. How do you know? And what do you do about it? Paul, what do you say?
I have questions to your questions. However, I'm already envisioning some individuals that I've worked with over the years. And the first question to the question that's coming up is how is it that they are coming to the awareness that there's something going on? Right. So sometimes a person has developed some level of insight and they're able to identify that something's not working right. Whether they're noticing that there's more arguments with their significant other, if they're distancing from friends, if they're noticing that at the end of the month they have less money going into savings or no money going into savings. Where's my money going? So are they aware of it themselves, or are they getting feedback from other people in their lives, or possibly being compelled by a loved one to consider making this lifestyle change?
So, but you're absolutely right. So what happens, what I have seen, and you tell me if this is the case, when you have a male that comes into your office and substance misuse is a big thing, is the thing, do they come in and say, I have a problem, or do they come in and say, my wife sent me? How does that work? You tell me.
So I see both, actually. It tends to be for individuals that are coming in and recognizing on some level that are recognizing some degree of misuse of alcohol. They likely have had several different treatment experiences before, whether that's going to formal treatment programs, or perhaps they've been in individual or couples counseling at some point in the past. For individuals that are coming in that might not be sure, it tends to be that they are coming in being compelled by someone in their life. And so if a person's not a teenager or not a young adult, usually the person that's compelling them is a significant other. Whether it's this is you got to choose stop drinking or get out of the house, or premarital. I don't know if this is the right move until we work out what's happening with the alcohol or other substance use.
I understand. Okay. So for those of you out there that think that your male partner is having a substance abuse issue, Paul, what should they do?
Talk about it. Absolutely talk about it. So there is an expression that addiction, and we're going to consider alcoholism or alcohol use to be encompassed in here, but addiction thrives in darkness. It doesn't stand a chance when you shine light on it. So the more that we don't talk about it, the more that we keep a secret, the longer the individual that has the substance use disorder is going to stay in that set of behaviors. So absolutely talking about it is going to be important. Connecting with professionals such as yourself to be able to find ways to coach through how to seek help for the loved one is also vitally important. There's peer support groups for family members or loved ones that have concerns for another's substance use. There's a variety of those. I don't endorse any specific one, but there are multiple different types of supports, as well as some people seek out counseling services as well.
And of course, there are all kinds of ways to talk about it. Yelling and screaming at someone is normally not the recommended way to say you need help, right, Paul?
Correct. So a little bit earlier, we were talking about young adults. So with the distress tolerance and emotion regulation, these are skills that we all hopefully learn and that we're able to use in day-to-day life. And so if you have a partner or a significant other who is using substances in a way that's creating stress in their life and your life, sometimes we ourselves can get challenged with our own distress tolerance, and then we struggle to not be reactive to our own emotions. And so that's where these emotional explosions come in, again, with the thought or the desire that if they see how agitated I am, if they see how upset I'm getting, then they'll get it and they'll change. Again, that's the thought of a person that's really desperately wanting their loved one to get it. However, unfortunately, as we tend to see quite frequently, it's really not effective.
Exactly. It's like when you're screaming and yelling at your kids, right? I used to do a lot of teaching. I taught middle school, I taught high school. If I was agitated by what was going on in the classroom and I happened to raise my voice, I realized that did absolutely nothing. Absolutely nothing. And the whole idea, I mean, what they teach in crisis de-escalation is if your loved one is at a 10, you need to be at a 1. You need to calm down. You need to speak in a lower voice. You need to have a more effective tone that is more even keel and calming so that somebody will respond to you. So that is absolutely the way to go. So I have also found that men seem to be in terrible denial when it comes to their substance abuse, about how much they're doing, how often they're doing it, and how dangerous it is. Do you find that's a big problem with men?
So there's layers to that. So I find that to be a problem universally for individuals that have substance use disorders or any type of compulsive behavior, if it's gambling, whatever else. So I see that across the board. The layer where the gendered consideration comes in can really take the shape of understanding that backdrop for shame of not being in control, shame for not being strong, for being weak. If I don't want my alcohol use to be a problem, but somewhere in there I'm recognizing, oh, you know what? I didn't want to drink more than a 6-pack this weekend. And yeah, that didn't happen. So if I acknowledge that, then does that make me weak because I wasn't in control, right? So denial is absolutely a part of the addictive process, hands down. It doesn't matter who it is. We take a look at the layers of what does that mean when it comes to masculinity, of not being in control of my drinking. That's really important for men.
Exactly. And then just to take it a little bit further, the whole idea of men being challenged to ask for help. That old adage, men won't ask for directions, they just go around in circles forever. That goes hand in hand with the masculinity issue, and I am too proud or too strong to ask for help, correct?
If I can't fix it myself, I'm weak, and therefore somebody else is stronger. If I'm asking somebody else for help, that other person is stronger than me. So I might not actively be thinking about that process, but the messaging has been ingrained typically from childhood.
So if you're in a situation where you have a male companion who you believe is really abusing something is compulsive, and it can be a substance use addiction, it can be a process addiction like food or video gaming or sex, pornography, all of those things. If something is being done to excess and you're watching this happen and you have tried to talk to this person repeatedly, does leverage work in the process of getting a man to treatment?
So there's a lot of different views on this. So on one end, there is the thought, the belief set that a person, quote unquote, for those that can't see my air quotes on a screen, that a person needs to hit a form of a rock bottom in order to change, to get sober, put your expression here. However, there is another equally large voice in the recovery community that says recovery by all means. And so especially for our folks that have substance use disorders where there's other layers of risk, for anyone that's seen the media surrounding the opiate epidemic, the increases of the amount of fentanyl that's being found in substances, as well as a variety of other newer substances that are cropping up. The longer that some of our loved ones are out there and using some of these other substances, the more at risk they are. And one of my speeches that I frequently give loved ones, spouses, parents, etc., is at the end of the day, you need to be able to rest your head on your pillow and say, I have a clear conscience. I was able to do everything that I could think of to do that I thought was appropriate to help and support my loved one.
Okay. Well, those are certainly words to live by. Excuse me. I have found also that the premise of intervention, the idea of having a licensed interventionist go in there and say, listen, stop, look, and listen to what you're doing, is the fact that the family will no longer tolerate this behavior because they're worried desperately about the mental health and well-being of their loved one that is in the throes of some kind of addiction. I have also found that being in recovery myself and just celebrating 38 years clean and sober and going into the rooms of AA and NA, everybody says it doesn't matter how you get here. It matters that you are here, no matter what. So every single loved one that doesn't want to be in imposition or doesn't want to fight hard enough or doesn't want to say things that may rattle the person you're trying to help, what we are telling you is, can you put your head on the pillow and say, I've done everything I possibly can?
Recovery by all means, right? I have to do what I have to do to support my loved one. If that means telling them when they don't want to be compelled, then that's what that means.
I also have the pleasure of working with so many people that come out of recovery treatment centers that I have worked with for 20 years. And when they come out of treatment, every single one of them says, I am so glad that I was made to do this. Okay. If they were forced to do this under some kind of leverage, if you don't do this, I will leave you. If you don't do this, I'm taking the kids. If you don't do this, you no longer have a relationship with me. If you don't do this, I can no longer be in your life. People that come out of treatment turn around and say, thank God somebody took a stand on my behalf. It may be painful at first, but like Paul said, recovery by all means. Correct, Paul? That's the way to do it.
That's right.
All right. So I want to talk a few minutes about what it's like for gay men fighting substance misuse and what it's like for them to think about coming into treatment and the kinds of programs that are out there. So talk to us about what that exploration and what that process is for a gay male that is thinking about recovery.
There's a lot of nuance that's involved there, and if I can even amplify this a little bit, right? Because there's gay males. However, when it comes to sexual diversity, there's a lot more than gay males. There's trans males. There's individuals who were born assigned as a male, however, may identify as non-binary. So when we come to like the full spectrum of gender diversity, there's actually a lot more when it comes to barriers to accessing recovery, to accessing supports, even just from like seeking help, whether it's from a treatment program or from a therapist. So all of the other considerations that we previously talked about, right? The cultural messaging, so on and so forth. A lot of this has to do with what's okay and what's not okay. And another item that we discussed a little bit earlier, that sense of community, right? We're humans, we're communal creatures. We need it. It's ingrained in our DNA. And so for males, like in the gender of males, we are a gender majority, right? Women are considered a minority there, even though we're kind of even, but just in regards to treatment wise, men are in the majority, hands down. When it comes to those who are sexually diverse, there is a minority status that's there, and a minority status that is very highly stigmatized. So being a gay male, I'm not going to give examples of, but how jokes of sexuality is used as a means to shame a person. So if I am a gay male and I'm trying to evaluate what's going on with my substance use, there's a whole other conversation about other factors that make gender diverse or sexually diverse individuals more at risk for developing a substance use disorder. That's a whole other chat there. But if it's already been identified that I have it and seeking help and seeking services, what is the I find myself trying to roll through several different thoughts here. What is the probability that I am not going to experience shame or rejection? If I am a sexually diverse person and I'm going into a 12-step meeting, am I going to be openly embraced, or am I not going to be comfortable or experience some version of rejection by sharing my story? If I go into a treatment program, am I going to be roomed with someone that has a degree of homophobia, or if this person might be trans or non-binary? If I identify as a female but my assigned sex is male, am I going to be rooming with another male that may have some degree of homophobia or transphobia? Will I be allowed to have a choice of housing? Will I be required to have a single room? Like, there's so many different considerations for accessibility. How comfortable does the person feel to share in groups when it comes to that degree of acceptance? Right.
You're absolutely right. And unfortunately, the whole idea of being, understanding that it's difficult enough to come in with the shame and guilt surrounding my actual substance misuse or process addiction misuse, on top of which I'm coming in with the stigma of shame and guilt surrounding my gender identity. So that's kind of like a double whammy, because for many people, I mean, they may come to treatment not being out to anybody, not letting people know who they are as a gay, bi, trans, non-binary individual. So one questions the validity of treatment to begin with, because what we learn in recovery is how to live an honest, open life. That's the biggest thing we learn. We are no longer going to live in duplicity. We are not going to lie, cheat, steal anymore. We're not going to do things behind people's back. We're not going to live in darkness. We're coming out into the light, like you said before. And here we are trying to be as honest as we possibly can, to know ourselves, to be who we are, and to be accepted for exactly our assets and our liabilities. And now here we have somebody that may be going through a gender identity crisis. And even if they're out to themselves, maybe are not out to the world. So it's two big things that they are uncovering. So one of the ways to help us out is to go to a program like New Jersey Recovery and Wellness, where there is a whole program and there are clinicians that are well-versed in gender identity. Correct, Paul? Things like that.
That's right. We are a gender affirming practice, and we actually have several members on staff that are sexually diverse. So that's a nice standout that I appreciate for the members that we bring onto the team. But same for people that are looking to receive treatment for substance use disorders. There are treatment programs that are higher levels of care, whether it's a residential or other types of treatment programs that offer whether it's a specific track of programming or the program itself is entirely gender affirming. So it's designed as a little bit more of a safer space for folks that have that consideration while they're pursuing recovery.
And the people that I've had on the show have represented such diversity. All right, Karen Treatment Centers in Wernersville, Pennsylvania. Other treatment centers around the country will have a track that will represent the LGBTQIA community, understanding that there is help for men and women of gender identity situations in recovery. Okay, so let's talk a little bit more. We have a few more minutes to talk about the advantages for men in general in gender-specific treatment. Let's talk about some of the advantages and some of the things that one can address in treatment for adult males.
So again, lots of really great, important topic prompts that you're bringing up, Ellen. Thank you. The key here is really being able to get to the heart of the matter. And so for men, for anyone, right, there's going to be a component in treatment where if we're in treatment, and especially within groups, right? So when we're talking about gender specific treatments, we're talking about higher levels of care, whether it's intensive or residential, so on and so forth. So when you're doing treatment in groups, if you have a mixed gender group, there can be a layer of the word that's coming to mind is positioning. Maybe I'll find a better word as we continue to go along. But I may experience distractions within that setting because needing to put on the show, or peacocking is the expression that's sometimes used for, I need to demonstrate my maleness, my masculinity, etc. And so if we're in treatment, it's going to be difficult to get to the heart of the matter, to process emotions. So number one, to process emotions amongst other men can be difficult. However, to process emotions in front of women, if there is a thought, a desire, a level of attraction, camaraderie that I have with other women who are in treatment, I may be less apt to want to reveal myself, to share my deepest, darkest secrets, to process my emotions. It's difficult to do that in front of men in general. If I'm experiencing an attraction with another woman I'm in programming with, that's probably going to shut that off because I don't want to appear weak. I want to be in control. I want to be a provider. I want to be seen as a sought-after male. The reason why that expression peacocking is used is with peacocks, the male is the one that demonstrates. They show off their colorful feathers to be attractive for the females. So gender-specific treatment really tries to eliminate the nature of that compromise in other treatment settings.
I was always a very big fan of gender-specific treatment for men and women individually for those absolute reasons. Okay, if I'm in a room with women, if I am talking just to women about women's issues, then I am not worried about impressing a man. I'm not worried about what I look like when I go into a room. I'm not worried about what I say to look like I don't know what I'm talking about, or whatever. And women are always worried about impressing a man for some reason, even if they're not outwardly concerned. There's something in their head that doesn't make them as comfortable. And I think you're absolutely right about men. Men decide that no matter what, they want to look strong. I can't tell you how many men really do need help, and we're really, really glad that you came today to give us all the things we need to know about men's issues in recovery. Please visit me at pushybroadfromthebronx.com. I am thrilled to have Paul Lavella Jr. of New Jersey Recovery and Wellness. Thank you so much for sharing these important issues with us today. We'll see you next time.
Thank you so much.
This is Ellen Stewart, the Pushy Broad from the Bronx, saying thanks for listening. And remember, everybody needs a little push.
From the Pushy Broad from the Bronx, New York.